Thank you. So my name is Arman, and I am a rising and senior at Johns Hopkins, and I'm excited to present some of the recent developments that we've had in this study. So we know that aging in general is associated with changes in adipose tissue characteristics, and particularly with this, we see a general shift of tissue towards the visceral adipose tissue depot, as well as general increases in adiposity. And in people with HIV, we typically see that there is an association with lipoatrophy characterized by a depletion of subcutaneous adipose tissue. And these changes may predispose individuals to cardiometabolic comorbidities. So we know that an increase in visceral adipose tissue is associated with inflammation and insulin resistance, and a decrease in subcutaneous adipose tissue may lead to greater spillover into these visceral adipose tissue depots and ectopic lipid storage. In addition to tissue quantity, quality is also an important measurement as well. And in this study, we looked at quality as indirectly measured by tissue density through CT scans. So sort of shown on the left part of the figure there, you see larger swollen adipocytes that are indicative of a lower density. And towards the right, higher density is associated with either higher quality adipocytes, or it can potentially be indicative of fibrosis as well. So in people without HIV, we see that adipose tissue density typically decreases with weight or adipose tissue gain. And in people with HIV, it's been shown that adipose tissue density may decrease after antiretroviral therapy initiation. So in general, in this study, we looked longitudinally to see what are the changes of tissue characteristics in people without HIV, and to see if those with HIV may have different trajectories in adipose tissue changes with aging. And we also know that this could have potential metabolic implications. And in this study, we looked at insulin resistance through HOME-IR to potentially look at those differences. So for our primary objectives, our first one was to first compare changes over aging in these adipose tissue characteristics among people with HIV, and specifically by baseline subcutaneous adipose tissue area. And the thought with this is that those with a lower SAT area potentially may have a greater level of lipoatrophy. So our hypothesis here is that people with HIV, and particularly those that have the lowest baseline SAT, so are the most lipoatrophic, might experience reduced SAT growth and have limited changes in tissue density with aging compared to people without HIV. And that could be due to fibrosis and other HIV-related factors. And second, we evaluated longitudinal changes of insulin resistance through HOME-IR by HIV status, and then again among those people with HIV by baseline SAT tertiles. And our hypothesis here is that the people with HIV, and particularly those with the low baseline SAT area, may experience worse HOME-IR trajectories with aging compared to people without HIV. So our study population was focused within the Multicenter AIDS cohort study, and particularly in 2010, a subset of men were recruited to an ancillary cardiovascular disease sub-study where they obtained paired abdominal and thigh CT scans. And a follow-up study in 2015 to 2017, these measures were repeated. So in total, there are 308 participants who had these paired abdominal and thigh CT scans from both visits and who did not seroconvert between these visits. And single slice cross-sectional scans of the abdomen and mid-thigh were taken, and they were manually traced, and through those measurements we were able to obtain the areas and average density of these tissues. And with those, we stratified them by baseline SAT tertile, which we again believe that that lowest tertile may represent a greatest degree of lipoatrophy. So to kind of show that, this is the spread of total SAT area at baseline among people with HIV and those without. And our primary comparison then was between those without HIV to, again, those in the lowest baseline SAT tertile. And in terms of insulin resistance measurements, we used HOME-IR as our estimate for this. And of those 308 participants, if they were included, if they had a measurement at least within 1 year of baseline and 2 measurements total. So in our final sample, there were 294 individuals included, and they had up to 20 visits per individual. So for the statistical methods to analyze this, we used linear mixed models. And for our first analysis, we looked to compare outcomes in tissue area and density over aging. And we first looked at that with just in people with HIV versus people without HIV. And then for our second analysis, we looked at those baseline SAT groups compared to people without HIV. And then for the HOME-IR trajectories, similarly, we first looked at those with HIV and without HIV, and our outcome was log-transformed HOME-IR. And then we looked by those baseline SAT tertiles to see if those differences changed depending on baseline SAT. So for the baseline characteristics of the population, we saw that those with HIV were slightly younger, had a slightly lower BMI, had reduced abdominal SAT area, and also, although not significant, did have a higher visceral adipose tissue area as well. And they had a median 9.4 years of living with HIV, and at almost 90% usage of early generation thymidine analogs. So to go into our first results, we shown on the right are these linear models comparing people with HIV and those without. The blue line is those with HIV, and the area is shown on top and the density is shown on the bottom. And we generally see here that both of the groups showed similar aging-related compositional changes, that increase in area and a decrease in density. Although it does look like, particularly in that first graph of SAT area over aging, that people with HIV had a greater magnitude of change in these categories, although it was not significant. When we looked at density then, so that cyan color is going to be the first tertile, which we believe to potentially be the most lipotrophic group, also saw similar increases in area over aging. And it does look like that the SAT area is slightly trending towards a greater increase. When we looked at density, we saw that those in the lowest SAT tertile group actually had a greater decrease in SAT density, but no change in VAT density. And it's also notable that they did start at a higher baseline with SAT density. Then going to the HOME-IR analysis, we saw that regardless of HIV status, HOME-IR increased with follow-up time from the visit. And interestingly, those with HIV did have greater rates of increase compared to people without HIV. And then when we looked at the changes between the specific tertiles, we interestingly saw that those in the highest total baseline SAT tertile actually started at a higher baseline and also had a greater rate of increase. And that greater rate of increase trend was also seen in the medium total baseline SAT tertile. But interestingly, that low total SAT tertile seemed to have a similar trajectory to those without HIV. So a summary of this is that we didn't see differences by HIV status for changes in adipose tissue quantities and densities. And although the people with HIV did trend to have greater magnitudes of change, we noted that individuals in the lowest baseline SAT, which we believe to be the most lipotrophic group, had greater declines in SAT density, but had similar changes in VAT density. And people with HIV, and specifically those with higher baseline SAT, did see greater increases in insulin resistance as measured by HOME-IR with aging compared to people without HIV. And our conclusions here are people with HIV still might be at greater cardiometabolic risk because although they do show similar trajectories with aging, they do start out with worse profiles. So they do start out with reduced subcutaneous adipose tissue and increased visceral adipose tissue. And interestingly, people with HIV and low baseline SAT do not have greater increases in VAT or reduced SAT expansion compared to people without HIV. So we kind of talked about the beginning about that presence of fibrosis, particularly in people with lipoatrophy. And one of those hypotheses was that that fibrosis reduces the ability for SAT to expand and a potential spillover of that into the visceral adipose tissue depot and ectopic lipid storage. But we don't actually necessarily see that happening with these models. And furthermore, people with HIV with that low baseline SAT have similar increases in insulin resistance over time compared to people without HIV. And then finally, we saw that people with HIV, particularly with high SAT levels, could potentially be at elevated metabolic risk due to their greater trajectory of HOME-IR with aging. And some of the limitations of this include the small sample size, the limited demographic generalizability, considering these are all men and they're middle-aged, and ultimately the use of tissue density as a surrogate of tissue quality, because there is some uncertainty what particularly that higher density reflects, whether that's fibrosis or the higher quality adipocytes. So thank you to all the study co-authors, and particularly Dr. Brown and Dr. Tilves, who have been working with me on this, and the MAX participants and staff and the funding for this project. And thank you.